Yeah, hello, lovely people. So, we are the final episode as far as our education on shock is concerned. And with the final episode, we would want to briefly go through the management of shock. So, with the management of shock, we are saying that it is imperative for the nurse, the midwife, or whosoever that is watching this educative material to manage any casualty for shock, because we learned in our previous episode that the shock can undergo through some transition or stages, and then it is better for us to manage it in its absence than us not being able to identify and manage, and for it getting to the final life-threatening irreversible stage, which would finally contribute to the death of the individual. So with shock, we are saying that let's manage shock as a critical issue in a sense that we have the brain, the internal organs, we also have the muscles, and then the skin together with the bones and the cartilages and joints all coming in conjunction to form the body. But in as much as the organ or the vitality is concerned, some organs would require some amount of oxygen much more than others. Some of the organs can survive over a period of time without oxygen than others. So at all times, the brain is vital. The brain is the number one essential organ, since it is coordinating all the other internal organ functions. So the brain would require oxygen. For me, I say it requires oxygen in seconds and in minutes. It shouldn't exceed 8 to 10 minutes. When the brain is unable to get oxygen, that is adequate oxygen, in less than 10 minutes, is an indication that the brain tissues will die. So the brain requires oxygen as far as the body function is involved. Then we can talk of the internal organs. So we have the heart, we have the lungs, the liver, the kidneys, the spleen, and other internal organs. These internal organs too might be able to survive deprivation of oxygen within some minutes to hours. So maximally, let's say 90 minutes, where 90 minutes is comprising of an hour and a half minute. So these organs, that is the maximum duration with which, when they are being deprived of oxygen, they can actually survive. So exceeding that duration, the internal organs would also start dying or degenerating. And then we have the skin and then the muscles, as in the musculoskeletal system. For them, they can survive over some hours. So you could see that then when we are managing shock based on our knowledge in the organs, then we would manage shock in a sense that blood should be restricted from the extremities or the musculoskeletal system, and rather should be redirected to the internal organs and the brain, so that they can survive and coordinate the other body function. So with the management, we can manage shock when we know the cause. So let's say we have a casualty and then there was an accident. The person had a compound fracture, so evident with bleeding and then a break in bone. The individual is bleeding profusely. We've learned about the types: hypovolemic shock. So based on the cause, is it because the body is losing blood or fluid, or is it because there is an allergy, or is it because the heart is unable to pump, or is it because there is an infection or sepsis? So the first aider should first identify the cause. And based on the cause, when we are able to take the cause out, or we are able to manage the cause, we would be able to manage the condition. Then we should position our casualty in a way that we would want to enhance venous drainage or the flow of blood back to the heart and then the internal organs. So what we do is that we elevate the lower extremities using pillows, or let's say for a casualty, the incident might happen, there are no pillows. So anything you can use to support the lower extremities and then elevate it. In the elevation, we have a limited distance. It should be within 8 to 12 inches. It shouldn't exceed 12 inches. When it exceeds 12 inches, the pressure of the internal organs would push on the diaphragm, which would cause the individual to become restless. So as much as possible, it shouldn't exceed 12 inches. And when we elevate, blood tends to what? Move from the lower extremities directed to the heart. Then also, this individual would go, as part of the cardinal features we talked about, the cold clammy skin. So with the cold clammy skin, we can manage the temperature by providing a blanket in order to enhance warmth, because as much as the individual is losing heat and then the temperature is dropping, then anaerobic metabolism tends to increase, worsening the condition. So cover the individual, and in covering the individual, you make sure if the individual is wet, let's say it was an accident, the person is in a pool of blood, and as a matter of that, the cloth is being soiled and is wet. We know that putting on a wet material can also contribute to loss of temperature or heat. So assess the environment. Is the environment also contributing to further loss of heat? Then you manage. If the individual is having a dress that is tightening the individual so much, we said the condition initially would bring about tachypnea or restlessness. Then we are to what? We are to ease the individual from that chest arrest or discomfort in the chest by loosening any tight clothing. Then we have exceptions. We should be careful when handling casualties, because some casualties should be left in the position in which they are in order to prevent them or to prevent their condition from worsening. So for example, an individual has a spinal cord injury. When you try elevating a body part or even the head, you tend to worsen the condition. So we say let the person be in that position in which he or she is. So the person should be put in that position, immobilization. Don't move the person, because moving the person would cause further damage. Or the individual has a head injury. The brain is in the head. When you move the head, you cause further damage to the cerebrum or the tissues of the brain. As much as possible, we are saying in order to enhance breathing and the relief of pain, let's help or assist our casualty also into what we call the recovery position. So with the recovery position, we don't want the casualty to lie at the back, and then lying at the back, there is a higher tendency that the tank can fall back, impeding on the breathing or respiration, and then also there can be aspiration of the gastric content, which would further exacerbate the condition. So you tilt the head to the side so that even if in unconscious patient there are any vomiters or anything that would come out from the mouth obstructing breathing, we can manage that by tilting the individual to where? To the side. So these among others are causes. So if let's say we identify the shock, if there is fracture, we also manage the fracture. If there is hemorrhage, we manage hemorrhage using the abbreviation, either it being fracture or a sprain or strain, using the abbreviation RICE, or we can also use in hemorrhage using the principles of the direct pressure, the elevation, and then the use of the pressure point or pressure areas. So, my dear, basically, that is how we manage shock. So, thank you very much for staying tuned all this while, and we really appreciate your audience. We would meet some other time in other discussions. Have a nice day. God bless you.